Wow. Yeah, my name is Dino Lopez. Yeah, I'm the new group of emergency specialists with the others like Dr. Ezio Brito and Maria Gosa. This moment I'm not in Maputo, I'm traveling, but I can't lose this meeting. That's why I'm on Zoom to see these beautiful guys. I have one, oh, Dr. Brian. I have one case and I want to present it to my dad. I have a desire to do what is our impact in the emergency department at the Maputo Central Hospital. Can you hear me? Hello?
We can hear you, Dino.
Yes.
Okay, okay. Yeah, I was saying, when I started working in Maputo Central Hospital, the first week, the director of the Central Hospital said, the first week, she desire was to measure the impact of emergency medicine in Central Hospital. The first week, we said it is not possible the first week to measure our impact. But now, after 3 months, I think it is possible to measure the impact of emergency medicine at Central Hospital. That's why I would like to do a study to measure this impact and demonstrate the hospital and otherwise how much our presence is very important. I every year now I'm doing the literature review. I'm creating the idea. How can I create the alternative reports? How can I create the research question? That's why I have many ideas. Maybe with your help, can I have the reason? What can I have in my research? I will show you now. Let me, where is this? Sorry. Okay, screen. Okay. Okay, what do you want to press? I have one case and my start, my review start. I don't know what can I start, but now I will start the case first. This case is the Dr. Brian, remember very good. This is a brick who present our research room. He's a 23 years old man. He fell for 4 meters higher while was painting. He came our research room with the loss of conscience. It was 12 for 15, 4 for 3, and the motor for 5. We reassess the patient and we decide to do MR with Dr. Brian. Dr. Brian, do you remember this patient? Okay, this is your picture. Okay, good. This patient, why I'm presenting this patient? Because this patient is diabetic. When the patient falls, we think that is a hypoglycemia. But after fall, every other consequence of the fall. That's why we said for the surgery, for neurosurgery, that this patient, otherwise diabetes, probably with this loss of the conscience, can have a epidural hematoma, subedural hematoma, or another intracranial lesion. Because in a patient with hypoglycemia, after correcting the hypoglycemia, normally the patient is good, is well, can talk. But this patient, after we correct the hypoglycemia, continue with the loss of conscience, 12/15. We talk with neurosurgery that to take the patient to MR or CT. They take the patient, but they send discharge the patient to home. Didn't do MR, neither CT. 3 days after, I find one doctor called Dr. Lydia this painter, this bricklayer, was painting the house of one doctor of his central hospital. She told me that patient he was seeing there, the neurosurgery discharged home. But 2 days after, the patient continued severe. He became to hospital. The second time they did the MR and they discovered that the patient have extradural hematoma, epidural hematoma. Only the second visitor to the hospital, they did the MR and the patient go to operate. What is the lesion for this case? Normally, when I decide a patient to loss of conscience after fail, the common lesion is the intracranial lesion. Can it be subdural hematoma? Can it do extradural hematoma? Can it do subdural hematoma? But principally, the extradural hematoma, the patient can be good the first time, but after some minutes, this can deteriorate. That is why sometimes it's very important to maintain the patient in observation, or I did the MR or CT in a moment to discover what is the problem and the manager in the operator room. The nurse send it to home, the patient deteriorates and come a second time. After the operation, the patient become good. I think this is a very interesting case. In case of a trauma,
Thank you so much for sharing that. I think for the moment, I'd like to, well, I want to give 2 more shout outs. I see Stephen Beck here. I didn't mention you earlier, another one of our board members. Thank you. And I want to hand the mic over to Dr. Brian, who's been kind enough to come on staff with us in Mozambique and help teach the residents. He's about to board a plane. And so, Brian, if I can hand the mic over to you briefly.
Yeah, good evening. I'm Brian Myers. I'm part of the pledge team here on the ground in Mozambique. It's an amazing experience to be part of such a great team who have dedicated so much time and effort to see Mozambique emergency medicine come alive. And then the extended team, those of you who have, followed Kevin and Abigail and what Pledge has been doing here. It's a pleasure to meet you all electronically, if somewhat perfunctorily, because I have to get on a plane in about 10 minutes to come down to Maputo. So yeah, in fact, that's the noise of the plane in the background here. Yeah, I think one of the questions about, I'm an ER doc and I've been here in Mozambique for about 12 years on and off. I've taught at one of the universities and it's been a great experience. And now this new chapter is opening up for me and for Pledge as it comes out of its embryological stages into a more of a neonatal stage. And I think one of the questions on the table, I don't know if can you hear me?
Yes.
Okay. All right. Hola, tudo bem, amigas? And then is what sort of impact has emergency medicine had in the last, say, 6 months, 12 months here as they've assumed a position there in the emergency room? And I think it's obvious that that patients who were not getting attended to because they were seen as futile are now getting attended to more rapidly. I had a case just last week of a gentleman who had a post-surgical he's probably been hypoglycemic for about 8 to 9 hours. We don't know exactly, but and his heart stopped in front of us and we did CPR and we brought him back and he
All right, I'm afraid we're losing Brian here. As you can imagine, we face many of these challenges in our Zoom meetings, especially as
that was still a pretty good story. The heart stopped and they brought him back. I think we're good with that.
Yeah, I do think he hit the highlights, thankfully, and I think that is one of the key elements. There's some other stories the residents want to tell. I think it's highlighting both the complexity of those moments, but also just paying attention to some of the little details that may seem rather kind of basic to us, but are overlooked when you don't have the right kind of training. I'll just check to see. I think Brian may be offline for the flight now. I will hand it back over.
I think if I can just add on to what Brian was saying, I think what he's saying about kind of changing the definition of futility. And I think it's really important to realize those of us who are medical or who are in the United States and have interacted with the US medical system, it's incredibly hard to imagine how little doctors in Mozambique and health professionals in Mozambique have at their disposal, right? We are trying to teach about management of COVID at hospitals in Mozambique where the whole hospital has one nasal cannula to give a patient oxygen. So it's limits of resource limitations that are unimaginable in any US or first world settings. And so I think it is easy to develop a sense of futility or hopelessness, which is really hard for us as doctors or health professionals. We do what we do with the help of hope of helping people. It's really hard to work in a place where what you can bring to the table isn't enough. And I think as we, and now our specialists with us, teach even the very simple maneuvers that can save lives, we get to give Mozambican health professionals the sense of their own capacity and ownership in saving lives and in changing things for patients. We can push for the health system and for the hospital and other specialties the idea of what is futile and when should we continue fighting. And so I really hope that we're actually going to create ripple effects that will change when we even give up trying. And with that, we'll save lives, and we'll help to change medicine's view of itself.
All right, thank you so much for that perspective. Absolutely, and we'll talk a little bit more about this, I'm sure, this evening. The kind of major changes that this challenges us to when all of a sudden we can start doing more for patients. Really involves not just clinical medicine, but changing your view of the patients and possibilities.